The outcomes of ACL reconstruction surgery vary by age. The older the patients are, the lower the failure rate. Unfortunately, the younger the patients are and the more active they are, the higher the failure rate. And because it really varies by graft and activity level, so it's very hard to give people one exact answer of what the risk is that you're going to have a re-injury, because it depends on what you do, really. One of the reasons that some of the older folks don't have a high risk of re-injury is because after they've injured their knee, a lot of them make a decision to not do that activity anymore. Whereas the young folks are trying to get back to their teams and their competitions, and so they go immediately back into the fire and run the risk of having a re-injury. My goal as a surgeon with my preservation first approach is to try and do the smallest surgery I can do to give you a reliable, durable outcome. And if that means I can repair it, great. And if I can't and I have to reconstruction, okay, we got to do it. Sometimes we even have to do more than reconstruction. We have to add a little extra, but at least we have options. There's a lot of tools in the toolkit. As far as the outcomes go, we've had excellent results. And if we look overall, we've seen roughly about 90% of the people do great. But the nice thing about it is that the recovery is much faster. Most people are done with their recovery at 3 or 4 months instead of 9 to 12 months. There's very little pain in the beginning. We just finished up a pain study showing that the repair patients use dramatically less pain meds than the reconstruction patient. They achieve their motion faster. The knee feels more normal. They return to sport faster. So what about the failure rates? It's critically important. And what we've seen is a split of the rate of re-injury at around age 21, 22, where the patients over 22, we've seen 5% of the patients or less re-tear their repaired knee. Whereas under 21, we've seen around a third of the patients have had a re-injury at some point around 2 to 5 years after they've had the surgery. That doesn't mean they can't have a reconstruction. In fact, if the repair fails, then we can always use the reconstruction as a salvage. I tend to add an augmented graft for the youngest, most active patients so we can try and bring that failure rate down much lower. The other thing that we haven't talked about is the risk of arthritis, because unfortunately, many people who've had ACL surgery know that 15, 20 years after the injury and the surgery, people start to get arthritis. And the arthritis rates of patients who have the reconstruction can be 20 to 30% at 10 to 20 years after the injury. We don't have exact data on the ACL repair patients, but if you look back at the old data that studied the patients who had the open procedure, the ones that did well, those patients in the long-term follow-up reports were shown to have very little arthritis compared to the patients who had reconstructions. So there is some evidence that ACL repair has a lower rate of arthritis.